for today's event. So let's begin our journey. Today, to open, we have Dr. Sandeep Mahajan with us, speaking on the topic of prevention of kidney diseases. He is Professor of Nephrology at AIIMS, New Delhi, and a leading figure in kidney disease research, education, and policy in India. Sir is the Education Ambassador of the International Society of Nephrology, Deputy Chair South Asian Regional Board of the International Society of Nephrology, and he's also the Secretary of the Peritoneal Dialysis Society of India. His role in shaping India's dialysis and transplant programs underlines his impact as both a physician and a policy advisor. Sir, we hand over the mic to you. You may present now.
So, thank you very much, ma'am, and thank you for this opportunity to be here. So, I would be talking about a vital organ which is not very commonly discussed. The kidneys does amazing work. It does so much for the body, and still very few people in the general public are really aware about the function, the role of the kidney. And it's the knowledge of knowing the functions of the kidney which forms the basis of prevention for kidney diseases. So first and foremost, we have to actually tell people how what vital work the kidney plays, and then only people would be more aware about the kidney diseases and how to prevent them. So the kidney obviously is vital in the sense it would have around 20% of the cardiac output, and we all know that it clears the blood of all the uremic toxins, of all the toxins which are found in day-to-day activity of the body. But it is also very important to maintain the blood pressure, to maintain bone health, to build up the hemoglobin of the body. And therefore, if the kidney fails, you would have involvement of multiple organs. The hemoglobin, the bone involvement, they all would occur directly. And then you would have progressive accumulation of the toxins and the acid in the body. So, what do we mean if we say that you have kidney failure or you have chronic kidney disease? It basically means that there is a sustained and irreversible loss of kidney mass and function. And this is the time when we say that the kidneys have started failing or they have failed completely. It is divided into various stages, starting from high risk to early stages of kidney damage, in which there is only mild decrease in GFR, to a progressive decline in GFR, to the tune that in the end they would be requiring dialysis or transplant. Once we talk about prevention, we have to know whether the kidney disease is a common problem or not. Chronic kidney disease currently is a global health issue of the 21st century. Much of the focus, unfortunately, has been on the patients who have end stage renal failure or those who require dialysis and transplant. It is important to realize that nearly 50 times the patients who are on dialysis the number of patients who are suffering from early stages of chronic kidney disease would be 50 times more than the patients who are suffering from end stage renal disease. The prevalence of chronic kidney disease in various populations is around 11 to 15%. And in India, we would have a approximate prevalence of around 12%, with around 2 lakh patients requiring dialysis being added each year. So what is driving this epidemic of chronic kidney disease? It's predominantly driven by various lifestyle diseases. Predominant among them are diabetes, hypertension, and obesity. Chronic kidney disease, unfortunately, does not give any initial symptoms or signs, and therefore, once the symptoms start coming, it's already too late. What so-called early symptoms could be having swelling over the face, over the eyes, to get up repeatedly to pass urine in the night, having uncontrolled blood pressure, or in patients who were previously having good control of blood pressure, the blood pressure control becomes abnormal, feeling generalized weakness, tiredness, and aversion to food. Once the chronic kidney stage develops to a larger extent, say to a stage of CKD 5 or 4, you can have itching, insomnia, neuropathic pain, vomitings, and in the end, pulmonary edema, which can be called as a non cardiogenic pulmonary edema. And once the patient reaches a stage of end stage kidney failure, the options are either to go in for dialysis or a transplantation. Dialysis and transplantation, unfortunately, are expensive modalities, and chronic kidney disease by itself, even if it is not to the stage of end stage kidney disease, would increase the cardiovascular morbidity and mortality to the tune of 5 times. So, once we have early detection of chronic kidney disease in place, we would not only prevent so many patients from entering into the cycle of end stage kidney disease, but would also prevent many patients from going into cardiovascular morbidity and mortality. So, early detection of chronic kidney disease is not only important to prevent end stage kidney disease, but also important to prevent cardiovascular morbidity and mortality. And obviously, prevention is better than cure, and nothing, and this can't be more true for chronic kidney disease. So, once we talk about prevention for chronic kidney disease, we should be knowing as to whom all to screen. If possible, everybody should be screened. And among so many of us, how many can confidently say that their kidneys are healthy and functioning well? So we have to increase to this level of awareness that most of us, like doing regular ECG checkup, regular blood pressure checkup, should also look at their kidney health. But if we have to establish a population or a widespread screening program, we would have to limit ourselves to high risk population. And that obviously would be elderly, diabetics, hypertensives, smokers, patients with obesity, patients having family history of kidney diseases or any past history of renal diseases. So many renal diseases, particularly acute kidney injury, though would normalize and we would think that the kidneys have recovered fully, unfortunately, the renal function reserve has been damaged and the kidney disease would slowly
This meeting
progress
is being recorded.
to subsequent renal failure. So, all patients with acute kidney injury or other renal diseases should be screened for any development of chronic kidney disease. How to screen? Actually, screening for chronic kidney disease is quite simple. You basically have to do 3 tests. That is to look for microalbuminuria, that is to look for any loss of albumin in the urine, to do a simple blood test to get a urea creatinine or what we call as kidney function test, from which we can have an estimated GFR, and to do at least once ultrasound for the kidneys to know that the kidneys are structurally normal and healthy. What can we do about making prevention for chronic kidney disease more acceptable? We would have to start early in the family, in the community, and the society, raising the awareness, as I said, about the important role of the kidneys in maintaining health. And since it's a silent disease, to sensitize the population to get regular screening of the kidney for the kidney health, to make right dietary modifications, to avoid junk food, to have a balanced diet, to have low sodium intake, low saturated fat intake, avoidance of complex carbohydrates, appropriate intake of fruits and vegetables, moderate the use of edible oils and animal food, avoiding processed foods, and keeping a control on the weight. Having a good physical activity also not only improves your physical health, mental health, but also would prevent chronic kidney disease, hypertension, and diabetes. We all know that smoking is bad for the lungs, causes cancer, is bad for the heart. It's also very bad for the kidneys, and kidneys are basically bunch of micro vessels, and smoking can badly destroy these vessels, and therefore avoidance of tobacco and smoking in all form is desirable. As I said, patients should undergo regular blood checkup. If you are a diabetic, have a regular blood sugar monitoring, regular blood pressure monitoring, and simple urine and blood investigations, as I suggested, are required for early detection of chronic kidney disease. Since diabetes is one of the very important causes of kidney diseases, good control of diabetes would prevent the kidney failure, and all the patients who are diabetic should have good diabetic control, good glycemic control, and regular checkup for their glycemic control and renal involvement. Another very important cause, especially in our country, is use of unsupervised medicines. So many times the patient would just go to the nearby druggist, drugstore or a chemist and take whatever medicines they want to take. They would be following so many forms of medicine without appropriate consult from a concerned specialist. And this unsupervised, persistent use of medicines can be an important cause for chronic kidney disease. So, just to conclude my talk, chronic kidney disease is a common problem. It is a serious, it has serious implications not only for the kidneys, leading on to end stage kidney failure, but also for increasing cardiovascular morbidity and mortality. Unfortunately, chronic kidney disease by itself does not have many symptoms till advanced stages, and therefore you have to undertake regular screening for chronic kidney disease. And more importantly, there are so many drugs and so many modifications in the diet and the lifestyle which are available, which can significantly slow or even reverse the early stages of chronic kidney disease. And therefore, if chronic kidney disease is detected early, it is still preventable to form a chronic kidney disease requiring end stage kidney disease later on. So, in the end, I will just leave you with these golden rules of keeping your kidneys healthy. Keep fit and active. Keep regular control of your blood sugars. Monitor and control your blood pressure. Eat right. Keep your weight in check. Maintain healthy fluid intake. Avoid tobacco in any forms. Avoid unsupervised use of pills and any medications. And get your regular urine and blood examination done if you have any of the high risk categories. Thank you very much.
Thank you so much, sir, for highlighting how lifestyle changes and early screening of kidney diseases can reduce the transplant burden. Your emphasis on prevention as a national imperative sets a strong tone for today. Do we have any questions? We don't have any questions yet, sir.
Just one question to Sandeep Mahajan, sir. Like in rural areas, particularly when somebody wants to know okay, how early they want to detect a kidney disease early, but where the resources are limited. So what would you advise, like for early detection of the kidney disease in a rural setting in a village area, if somebody is having some symptoms and they want to check, they want to, they want this to be altered.
Fortunately, for detection of chronic kidney disease, the investigations required are not complex. Most of the villages or primarily held dispensaries would have a routine analyzer to look for the blood urea and serum creatinine values. A simple urine dipstick can tell us about proteinuria, though it might not be as sensitive to tell us about albuminuria, but it can tell us about proteinuria, and a simple ultrasound examination. These regular, easily available investigations can actually help us in screening so many patients with chronic kidney disease. And most of the primary health centers actually are now equipped, and even in a certain national programs, in certain state programs, the ASHA worker or the peripheral healthcare worker can do blood pressure monitoring, can screen the patients who have high blood sugars, high blood pressures, and then can refer them subsequently for further screening to a primary health center or a district hospital. I think so. If we form this kind of hub and scope model in which the most peripheral worker can screen as many population as possible, and then refer the cases by escalating it to subsequent levels, this can screen so many non-communicable diseases.
So we have another question for you. Are there any genetic causes of chronic kidney disease, and what are the ways to mitigate them early?
I did highlight that those patients who have family history of chronic kidney disease are more likely to have kidney diseases. Yes, there are few common conditions like polycystic kidney disease, which is a very important cause of chronic kidney disease. That would be, say, 1% of our total population. So, if you see, they would be causing around 10 to 15% of patients who have end stage kidney disease as a burden. But there are so many genetic causes which are still not completely known or completely evaluated. And therefore, any patient who has a family history of kidney disease automatically becomes a high risk for chronic kidney disease. Even patients who have diabetes, if they have a family history of kidney diseases because of diabetes, these patients are more likely to suffer from diabetic kidney disease. Therefore, the awareness that chronic kidney disease or kidney diseases do run in the family is important. There are many more important genetic causes for kidney disease as well, but they might not be that common to have a general interest.
All right. Thank you so much for an insightful talk.
Thank you. Thank you very much for the opportunity.